Well, thank you very much, Carter, and it's a pleasure to be able to talk about this topic today. And regarding the webinar that you mentioned on March 25th, I do believe there's some information about that at the conclusion of this session, so I'll be sure to put that on the screen. Today's topic is focusing on grading your own assessments. In other words, looking at the quality of your exams through the lens of your understanding of statistical item analysis, the concepts of reliability, basically a little bit deeper dive into some of the content that I presented previously that had to do with writing critically thinking style test items and constructing exams using a systematic framework for analysis. So today's information, you may see some of this reiterated that I've talked about on previous webinars, and if you haven't looked at that material across things like building testing committees that Carter had mentioned and creating your own critically thinking test items, those webinars are indeed on the ExamSoft website. So a brief recap in terms of where evaluation, your assessments sit within your entire curriculum structure. Each of these areas of instruction should talk to each other. I use that concept as obviously the objectives for the curriculum should guide the instruction, and the evaluation mechanisms, particularly the tests that we'll be talking about today, should speak to that instruction and should refer back to these objectives, ultimately with the goal of evaluating where the students sit in terms of their ability to demonstrate the program's outcomes. So achievement of program outcomes can be viewed from the information gathered through an effective evaluation. And these should all tie in. When they tie in together, we talk about that actually living within the instructor's golden triangle, the place that you always want to be with your curriculum at any given time. So in a previous discussion about how to write really good test items, these were some of the guidelines that I presented that are very relevant today. The reality is you can't do an effective deep dive into your item analysis and get the results that you want if you really don't have good, solidly constructed and very effectively written test items that comprise the exam. So you do have to have the basics, and I'm going to talk about these basic tools that are necessary to really perform well in writing your items and in creating that good test. You do need to write those items intentionally at a very high level on the cognitive taxonomy. There are certain what I call housekeeping duties, or basically style form guidelines, that are very effective when they're used across the curriculum in a consistent manner, because taking some of the distraction away from students in the way the test items are written and presented on the exam actually can indeed affect their performance. And they're going to be taking obviously very consistently constructed exams from national certification and licensure bodies. So you really want to emulate that practice in your own teacher-made test banks and exam banks. You do want to have a test blueprint. I'm going to really talk in a little bit more detail today about why that is so important. And of course, the main focus today is to look at that scientific analysis that you need to perform on all of your exams every time you give one of these exams to your students. So we're really going back to the basic critical thinking definition, the process of analyzing and understanding how and why we reached a conclusion. This is the kind of skill in your students that you're really trying to get at with your tests, not what was typical in days of old, which is, you know, how much can a student memorize and simply recall or parrot back to you. That's not going to be an effective way of telling what they really know and more importantly, how they use the information that they know. So we will be focusing on the upper end of that Bloom's taxonomy, the cognitive taxonomy. We've got the original version, the newer updated version, but really they're in parallel. All of your questions should be written at these application and applying levels and above, and not really focused on the remembering, understanding, or the original knowledge comprehension level as it was described. So assuming that you have those basic principles about critical thinking, test item writing in play, how can you really analyze your exam and critique your own effectiveness as an item writer and the effectiveness of your test? So that's where we are today. We're going to take, as I said, a deeper dive and look specifically at some of the item writing an analysis criteria now to really determine how effective your test is. The Monday morning quarterbacking scenario is my favorite way of thinking about a post-exam item analysis. You would never have a successful football team that didn't have the all-important meeting after the weekend to dissect everything that happened, to look at the film, to figure out what was right, what was wrong, what needs work. And that's really the same approach you need to take with your item analysis post-exam. So important to determine the quality of the test, the effectiveness of the items. And of course, this is going to have some variation in it because every student group is different, every student is different. But underneath that all, there should still be some consistency in the scores so that you have an instrument that's doing a very accurate job of measuring those variances in the student's performance. So the most important aspect of your beginning analysis here of your test is to really think about the reliability of the exam. How consistent are those scores? So ask yourself, if the test taker took an exam today, would that same individual obtain the same or similar score on an exam if it was taken again next week? Now, obviously, there's some impracticality to that question because the minute the student has read the test, they have what we call history with that test. They now really recognize some of the particulars about the test item. So if you gave the test just a week later, the human memory is going to be strong enough and accurate enough so that they may be able to select correct answers, not because they effectively apply their knowledge, but because they simply remember those from their previous experience with the item. And so as you can tell, unfortunately, that would have moved the test back down the cognitive taxonomy to strictly a memorization exercise. So we need another way of establishing that scores that we get from this exam are consistent without giving the same test to the same group of students over and over again, which is just not a practical methodology. So to do that, we turn to statistics, and before everybody screams and runs out of the room, my mantra on these is that if you see this range, if you can count from -1 to +1, you're going to be able to handle this statistic. So it's not going to be scary. This KR20, the Kuder-Richardson 20, is actually a formula you may be familiar with from your research background. So it's essentially looking at the same kind of relationship that a Cronbach alpha would look at, but it's specific to dichotomous data or a binary situation. In other words, where one answer is correct and all the other answers, doesn't matter how many, frankly, are wrong or incorrect. So looking at that type of dichotomous data relationship, what you get is just a fine-tuned version of looking at a Cronbach alpha across something that might have an array of answers rather than just one right and all the rest wrong. So it's something like a Likert type scale that you were evaluating. So a good example of how to interpret the KR20, if you've ever looked at your statistical analysis information that comes off of your computer program, hopefully if you're using computerized testing, even using some of the basic test administration softwares that you find with some of the learning management systems, you get a basic KR20 for the exam that's just been given. So if your KR20 was 0.71, that means that 71% of the total score variance on the exam will be attributed to the true score variance. So if I'm interpreting that then as the individual who was giving this exam, I would say, gosh, with a 0.71, my high-scoring students are the ones that are indeed answering the test items on this test correctly, and the low-scoring students are consistently answering the test items incorrectly. And that would be assuming that I had this good reliability in part fueled by a really good discrimination index or discrimination coefficient that could be computed. So that's the second statistic that we're going to look at with a little bit more scrutiny today. The point biserial correlation coefficient as an example of an ability to discriminate students that are higher scoring from those that are lower scoring. That will contribute to the reliability and the consistency of scores that you get from this exam. So on previous webinars, I asked for a bit of trust. In other words, I just said there are standards for acceptance, testing committees that are being formulated in higher education disciplines around the country now are those that will set standards of acceptance based on the psychometric literature, in their own disciplines, literature, those groups will publish these, hopefully, to the faculty so that they can be used as guidelines for effective testing in the department. Now what I'm going to do is present those same standards, but give you more of a rationale as to why these standards exist. So the first one we've already mentioned, the KR20, kind of foundational is the way I look at it, and that's why I put it down here at the bottom of the page, that our goal is to strive for a 0.70 and above level on the statistical analysis of your exam. So if your KR20 is above 0.7, your exam is really doing a good job. There's components, obviously, that affect this. So the item difficulty would be one that we need to take a closer look at. Item difficulty level really refers to, obviously, the number of students in the class, or expressed as a percentage, that actually get the question right, the ones that answer correctly, as opposed to students answering it wrong. And I think that's the tough part. It doesn't really seem intuitive when you look at item difficulty as a numeric value the first time. I think you have to kind of turn your thinking upside down. So in other words, as the score improves, as the score moves, the item difficulty level improves up to 90%, that actually means that the test is getting easier. So more and more students are answering correctly, and so the item difficulty level is very high. So let's look at that as a component. We're going to come back to these other two, the discrimination information, in just a moment. But let's think some more about what does item difficulty mean when you're looking at your test. Well, typically what you'll see is that mean difficulty levels on a teacher-made exam, and I'll reference nursing since that's the background that I come from. Most teacher-made nursing exams have a mean difficulty at about 80 to 85%. And you can probably intuitively, again, arrive at that because you can realize, gosh, that means then if students are getting about 80 to 85% of the answers correct on this test, then that's where their scoring level is. And indeed, many nursing schools will publish, cut scores for exams and even for final course grades. Typically are not going to drop very far into the 70s when they start attaching letter grades to these type of things. So it's not unusual then to see a lot of students, about 80%, most of the class will actually answer most of the questions correctly on the exam. However, this creates some potential concern when we start trying to compare results of students from their teacher-made exams and then what happens on a nationally normed exam, or for instance the licensure exam in this case that I've referenced. So sometimes I'll have faculty ask, well, gosh, I have a good KR20. My difficulty level doesn't seem to be a problem, so why am I having low NCLEX pass rates when my mean difficulty levels are really staying up there in that 80 to 85% range? So I'm encouraging you, whenever I put my little coffee cup, and glasses there, put your thinking together. Give yourself a few minutes to kind of ponder this question and see if you can come up with your own response to it. This has been a problem that has really concerned faculty, I will say, certainly since the elevation of the passing standard on the NCLEX RN that happened just a little over a year and a half, maybe almost 2 years ago in 2013. What I would say in answer to this question is that the NCLEX results may still be below standard because item difficulty alone is not going to define your test item quality. You may really be seeing cognitive levels of questions on your exam that are frankly too easy. So if the test items are too easy, the students are not going to be adequately prepared for the NCLEX style questions because they get used to that steady diet of frankly pretty easy questions on the exam. So what I would do first if I was seeing this kind of pattern happen, I'd go back to my exams. I would really look hard at the items that were in use and make a decision. Am I incorporating too many items that are at that knowledge and comprehension level and not enough items that are at the application and above level? So your first action then may be to replace items that are at the knowledge comprehension level with application and above items and see what happens. Yes, indeed, your scores are likely to drop. Your students are going to have a difficult time with these, but you've got to give them the amount of practice that they need to get ready for that, so that when you expose them to your teacher-made test that has application above style items, nobody's panicking, they know to expect it, and it really indeed forces them to change their study habits and the way they approach class. So I'll give you one other rule of thumb here, that an optimal item difficulty for the standard 4-option multiple choice type item is about 63%. So that's pretty tough. You know, that's just a little over half the students actually getting the question right in many situations. So be aware that as that number pushes up into the 80 to 85% range, then you're going to possibly see your KR20s drop a bit. So these are those interrelationships I want you to really think about now when you're looking at your item analysis a little bit more closely. There is then one absolute I also want to talk about, and this is an absolute from my opinion, working with these kinds of statistics for many, many years, and that is that if you already recognize that the mean difficulty level should be 80 to 85%, but you know now that on a multiple choice single answer type of item, typically with 4 choices presented, it could be 63%. How low can you go? What is the lowest acceptable value for each test? Well, the approach that I would give you for answering this question is that you've got to be able to assure that your difficulty levels for your questions are at least at the 30% or above. So if you remember to our standards of acceptance, 30% is the bottom end. 90%, frankly, should be the top end of your range of difficulty levels. So I'm asking you to think again. There's that old coffee cup. Think again. Why would it be important to take some kind of action at a 30% level? Well, I will say that, as you can see in my slide here, 30% or less is a scary situation for a question. That means that the question is too difficult, or frankly, only 30% of the class or fewer can answer this test item. And that means that you've introduced an inordinate amount of guesswork into the whole situation. So if you go back to basic probabilities, if there was a single answer 4-choice type of item that you gave, each of those items randomly selected could be chosen as much as by 25% of the class, 25% for each of the 4 items. That means that you have opened up a question here that people are answering potentially by total guesswork alone. Now, to the student, I'm sure they feel like they've hit the lottery if they can randomly select an answer. But to you as a faculty member, you've just lost ground. That's a question that is not giving you any usable information about what your students actually know or don't know about the concept that you're testing. So in this situation, I would say this is your absolute rule, that if you've got a test question with a difficulty level of 30% or below, you're going to have to take an action. And we'll look at the kinds of actions you can take later. These are things like nullifying, giving credit, deleting the item, etc. The bottom line is you're going to have to do a rescoring situation here before you go in and actually compute your final grades, because this question is not working well for anybody. Now, what about on the other end of the spectrum? What do we do with high difficulty levels? In this case, I'm talking about the items that virtually everybody in the class is getting answering correctly. Test items with high difficulty levels, so greater than 90%, are usually going to give you poor discrimination values. And of course, that's because you've got all levels of ability taking the test among your students, but everybody's getting the test question answered correctly here. So one of the things you've got to be careful of is including items where everybody is starting to approach getting the answer correctly. There's only one situation that I can think of when it would be appropriate for literally the entire class to answer the item correctly, and that would be in a situation that we call a mastery item situation. So with mastery items, these are items the faculty would assume that if 100% of the students do not answer a mastery item correctly, they have missed out on essential content. And again, you must take an action here. There needs to be some reteaching that happens very quickly, because typically this is an action item for you that relates to a kind of a situation in the curriculum where everybody, the faculty, have decided that this concept is so important, everybody needs to get this question right. Now recognize there's a potential loophole here that you can get yourself wound up in, and that is you've got to identify the mastery items before the exam. If you wait until the exam is over and then you see a series of items that have answered, students have answered out at 100% of them getting correct, you might make the misstep in assuming that those were all mastery items, when in fact some of them may not be the classic important content in the curriculum. They're just simply easy items over a portion of the content that you taught that may or may not be considered important essential content. So the decision needs to be made before the exam. Figure out which items are mastery items. Remove those items from your overall analysis of the test, because obviously they're going to skew what happens with your KR20. They're seriously going to impact test discrimination. So they need to be removed from evaluation. What you want to know essentially about those items is that indeed everyone answered the correct content, the content correctly that was deemed essential content. And one word of caution, I would not put more than 10% mastery items on any test. An item that every student should know typically will have a better form of evaluation that you can use to ensure that they have this essential content. I mean, a classic in a nursing situation is students need to know CPR. Every student in every kind of patient encounter should know basic CPR. Well, there's a lot of other ways to assess that including test items about it. So you may have some on your test, but you shouldn't have more than 10% because you've got other ways at getting at assessing student competency for that particular type of essential content. So here we go with the standards of acceptance. KR20, again, remember, needs to be at 0.70 and above. Item difficulty level, there's your two markers. Should never go below 30% or you've got to take an action. Should not be above 90% in most situations. The one exception to that obviously being mastery items. 100% of the students should answer those questions correctly, but those should comprise no more than 10% of your total items on your test. Let's go to the other two then. Let's look at item discrimination ratios and point by serial correlation coefficients. These two are really considered to be indexes useful for establishing the discrimination value of your test. So let's think more about item discrimination on your teacher-made test. The IDR is pretty classic. It can be calculated very quickly, but it doesn't consider the variance of the entire group, and for that reason a lot of people have kind of moved away from looking at IDRs except for a quick kind of eyeball glance, and instead, because of the value the computerized programs bring in computing the correlation coefficient for you, there's less manual, or in this case no manual effort required. You can then look at a value that may bring you some more information about what's happening with this question. One of the things IDR can do on a quick kind of an eyeball approach is show you almost immediately items that have very poor discrimination, or in a worst case scenario, a negative discrimination value. And if you recall, negative discrimination in this case would mean that the lower performing students are actually answering the question that you have under review correctly, or conversely, that higher scoring students are not answering it correctly. So it leads you to question, well, what's going on with this particular item? Point by serial correlation coefficient is the more powerful measure of discrimination, and it does consider the variance across the entire group, not just your upper 27% and lower 27%. When you have a small number of students that are taking the test, this is going to be a little bit of a tough situation for you, because you're not necessarily going to see the statistics play out as effectively with the small n, or the small number in the group. So a cumulative PBCC for a question that is based on the student responses across several cohorts will be more powerful. You get a bigger sample size that way, and you'll probably get a better idea of how the question is performing. Think about the kinds of things that can impact your discrimination values. And if you're seeing poor discrimination with a question, ask yourself some things about that particular item. For instance, is this particular test item outdated? Maybe that's the reason why a lot of people that you would expect to get the question right, like your high-performing students, are not answering it correctly because they're actually more well-versed on changes in practice that you have gone over, perhaps in classroom or clinical activities, but that's not showing through on your test because you've got an outdated item. Is the content being taught differently across this group of students being evaluated? So in other words, are part of the students at maybe a clinical agency you've used before, but one group is going to a new agency? Maybe there's some differences in practice that the students are viewing at one agency versus another. Do you have the same thing happening with new faculty? Maybe there's a faculty member teaching in the course that's new to it, that was not teaching in the course before, and they may be approaching the content differently or maybe completely omitting that content. And that's why you're seeing variation in the way this test item is performing in terms of discrimination. Has there been a security breach affecting the item? In other words, if students are already walking into the test knowing this test item, knowing the answer, then you're not going to get valid data. So in that case, you might suggest, well, maybe we're going to have to do something with this item if it used to be highly discriminating and all of a sudden now it's become less effective. In those cases, I use 3 R's. I retire completely, take it out of the item bank. So retire the item. I rest the item. In other words, I pull it out of the active bank for a semester or maybe even 2. And then it won't be common knowledge among students coming in after those folks have graduated or moved on. Or finally, I rewrite. If this is a problem with a test item that's so widely known by the student body, it's not going to ever be effective. So it may be better to just rewrite it. So retire, rest, or rewrite your items if you suspect that there's been a security breach that's affecting discrimination. And again, for these small numbers of test takers, for less than 30 students, look at your cumulative results before you make a lot of decisions about what needs to happen with the item. Here are some of these decisions that you can really think about. And I mentioned them a minute ago, that when you have one of those absolutes and you've got to take action before giving the students their final grades, you need to really decide how are you going to treat this. Another advantage to having a testing committee is that the decision-making algorithm for this can already be kind of pre-thought out. So you're not under pressure in the heat of the moment with all the students eagerly awaiting their test grades and a lot of their surviving in the course. All the drama surrounding this needs to be made. So I would encourage having the faculty, either through the testing committee or the broader curriculum committee, think about how these should be these kinds of decisions should be arrived at before you get in the middle of a tough situation. So in this case, there's really 3 actions that you can take. In any of these actions, you're going to have to rescore the exam. So that's why I've always been a proponent of not making immediate release of grades to the students. Some of the testing applications certainly can do that, and you can give them that opportunity as long as you couch it within the syllabus and you make them very aware of it verbally before you give the test, that any grade that's calculated is considered to be a tentative grade until the exam can be fully analyzed. So you should put in your syllabus the amount of time that's reasonable that students should expect before their final grade determination is arrived at, and build yourself in that time. Be faculty friendly to yourself, in other words, to give you the time to do a proper analysis, to take these actions, to do the rescores before the students receive their final grades. So these are the things that can happen. You can be giving credit for more than one choice. This is typically an action that faculty use when indeed they've located another reasonable answer among the ones that were offered as choices. I should give you a caveat, though, that just because large numbers of students choose a particular option, that doesn't justify giving credit for it, unless it's a realistic option that is clearly, correct, that you can document and validate. So credit may be one action that you may want to take. Another action may be to nullify the item. This would allow giving credit for all the choices, which essentially means that the test item doesn't contribute really to your understanding from what you're reading among these test results as to what students know and don't know. So this item basically sounds exactly like what's happened to it. It's now nullified. It really doesn't have any bearing in terms of how the test is evaluating your students. The students who answered the question incorrectly are going to see their scores rise, and that can be a thorny issue with the class, while those who answer correctly can have their scores obviously then remaining the same. So that's why I say it's important to figure out if this is going to be the approach you take. Know that in advance. Students understand the consequence of what nullification means. And in this case, the one factor that's important to a lot of faculties is the fact that the total number of test items included in the scoring calculation remains the same. So it's not like you're increasing point values across all the other questions when you take this action. The last one, the test item being deleted, results in just that, but this is one action that is commonly used by faculties, known as throwing out the item. Just remember that when this does happen, the total number of test items included in your scoring is reduced, so the point values for each item left on the test are going to increase, and that means that students who answered this item correctly will have their scores decrease, and those who answered the item incorrectly then will see their test scores increase. So each of these actions, there's no perfect response and there's no perfect action for every situation. You need to really weigh what's necessary. But again, remember the one absolute that I gave you. The only time you absolutely have to take an action and do the rescore is if the difficulty level is below 30%. Meaning that people have just wildly guessing situations going on with that test question. So consider your consequences, and ultimately it's your judgment as the expert that will be critical in determining which one of these actions should be taken and understanding how it affects the student's scores. We also make in nursing a little bit of a variation with both the point by serial correlation coefficient and the KR20. And you'll notice that these values are slightly different from the standards across all other disciplines. And there's truly a reason for this. So if you think about why would we say, oh, well, a KR20 of 0.6 or 0.65 rather than 0.7 is acceptable, and a point by serial correlation coefficient of 0.15 is acceptable, there is a rationale for that. And that is because variance is the driving concept behind these correlations, and when there's less variance in the test scores, you're going to see the reliability of the test decrease. So the KR20 is going to drop. And there is a situation with nursing students in particular that contributes to lack of variance in their scores. So if you take a few minutes and think about what contributes to that, these would be things like very similar high admission standards. They come in with high GPAs. There are higher attrition rates perhaps in the lower division of the courses because students who don't have the requisite academic skills to successfully complete the nursing courses don't move forward in the course progression. And then when they do enter the upper division of the major or the specific nursing courses, however you have those defined in your curriculum, you'll find that many of them have obviously the very same nursing experience. They have faculty members that are the same because the nursing faculties may be a pretty small and cohesive group as compared to some of the much larger departments on campus that teach courses that are at the more gen ed or some of the lower division of the majors. There are very similar clinical experiences using the same clinical agencies and even the same instructors, and these happen every semester that students are exposed to. And at the point that your students are at the point of graduation, there is very little variance because you've been applying the standards, and students who have not been successful in meeting those are no longer in that graduating class. So as you move up, you're going to see KR20s are not going to necessarily indicate the same strength that they might have in some of the previous courses. and you need to understand why that's happening and what the impact is on variance when you start seeing a very homogeneous type of class. This will lead to, what are we going to do with all this information after we analyze our tests? Well, one of the benefits of using a computerized testing program and an application that will store that data for you is that you can actually use the item analysis data to focus your editing. So you can target items for rewrite that are based on what you're seeing with the results of your item analysis. So this is good news. You need to throw yourself a party because you don't have to write the entire test over again. You only have to pinpoint areas of items that are having particular problems. Response frequencies are probably one of the best places to look when it comes to pinpointing areas for rewriting. And in this case, I use that less is more philosophy. If I can maybe just change one piece of a question, one option that has a very poor response frequency, that is a huge time saver for me because I'm not rewriting the whole question. I'm just plugging in a much more plausible option into my exam. I can sometimes even see immediate improvement the minute I plug that option in the very next time I give that test. And that is certainly heartening. So one of the things I'd say about this is when you have 100% of the students answering correctly, first make that judgment. Was this a mastery item or is this item too easy? If it's a mastery item, you should have removed it from analysis because it's handled separately. If it's too easy, then that's an indication that you've got some rewriting ahead of you. Target the rewriting for 0 distractors, the options where 0 students are making that selection. That means that that option is not plausible to them. In fact, it may be so obviously not applicable to the question in your STEM that even the poor performing students ignore it. So that's a way to really automatically improve your discrimination for that item by zeroing in on the 0 distractors. Get those handled. Here's your 3-step method. You've looked at difficulty, you then look at discrimination, you look at response frequencies, and then you kind of got your work cut out for you in figuring out exactly where do you need to do some pinpoint editing before you make another test, before you give these items on a future test. And of course you use this information to determine for the test at hand with this particular group of students, do I need to do a rescore? Here's an example of an item analysis report, and just so that you see the points of reference are all going to be here. The computer program will give you the KR20. You'll be able to get all of your information such as difficulty level, in this case the percentage of students overall answering the item correctly. Here's the makings of your IDR because you've got the upper and lower 27% difficulties there identified. There's the PBCC. And here's the response frequencies, and you can see almost immediately the grayed out are the correct answers that are being selected by students. The 0s, no students are really choosing those options obviously at all, and they're not the correct answers. So as you review any of your information that comes off of an item analysis report like this, do it in a systematic way so that you can be as thorough as possible, but save yourself some time by using the results of your analysis to target where you're going to make your interventions on those test items and improve them before you give those items on another test. So for example, if we went through difficulty first, obviously we'd want to know if the 100% item is a mastery item, then let's not analyze it, let's take it out. On the other hand, if this particular item had 100% answering correctly and it's not a mastery item, then you know how to call it. It's too easy. It needs to be rewritten. What's the first thing we can do? Well, we need some plausible distractors in here because it has no discrimination value. Everybody's getting it right. We got to do something to put some plausible distractors in. After I look at difficulty level, I'll move over to point by serial correlation coefficient and see if my PBCCs are showing me any problems. Remember, I want 0.15 and above. So this is not a highly discriminating item, probably because it's somewhat easy up at the 95 level. Here's the red flag. I've got a point by serial that's a negative discriminator. So in this case, you've got a problem. That means the poorly performing students are actually answering this question correctly. That question needs to be addressed right away. Here's another negative discriminator. So you can see as you walk through the test, you can start constructing more or less a to-do list. What do you need to look at first? What needs immediate action before we release these scores for this test to the class? And then what editing do we need to do for the future? These kinds of reports that you can get in the ExamSoft application can give you similar types of reports, help you group these according to your standards. So anything that falls in the difficulty range between 30 and 90, you can be happy with. You don't need to do anything with these questions. Anything that falls 90 or above, first you need to identify the mastery items and get them out of there. If it turns out that these are all mastery and it's below 10% of your test, you're done. Nothing needs to be done there. These items need immediate attention. See that 30%? This is not acceptable. You're going to have to do something with those three. But it really pinpoints your effectiveness in addressing problems and future actions that you need with your test by using the statistics to guide you. Same kind of analysis with your PBCC. If you've got something in the acceptable to excellent range, perfect. Leave those alone. Something marginal, how difficult was that question? Maybe you can address that if you see a question, obviously, that had a problem with difficulty and now also clearly has a problem with discrimination. That's just all the more evidence that you need to get in there and do some rewriting with that question. Storing the data is important, and these are some examples from the ExamSoft application. The response frequencies pop out immediately, and they're indicated with the big red zeros, so that you can tell right away where you need to start making some changes. Point by serial is indicated. All the data that you need is here. The really great thing about this is it also stores it cumulatively, so that, as I said, if you've got a small number of students, you don't have to make your decisions about rewriting of items or rewriting of the answer options just based on 30 or fewer students. You can actually look across multiple groups of students that have taken that item. We need to say something about validity. We spent a lot of time across the measures of reliability, but this is where test blueprinting comes up, and I want to make sure that this concept is really well understood. Content validity on your exam you need to be able to answer with assurance that the test measures what it claims to measure. That means that it's got to map back to your course objectives, that it needs to flow in a logical manner. There's got to be rationale for what you do in putting items on a test. Sometimes teachers will approach this by saying, okay, I've taken my course objectives and then I've taken my course calendar and literally looked at the amount of time that I've spent covering a particular topic. That should inform you further about what your test construction needs to look like. If you had a piece of content that really wasn't examined as a priority in the course, maybe under 5% of the course time was spent even looking at it, then there better not be a large number of questions addressing it on the test, or you've begun to add some frailty into your ability to defend that test and show that it's a valid instrument for measuring the course objectives that you were teaching. Excuse me, the testing software program, again, can be extremely valuable here because the information from the last administration of that test that you gave is stored, and then, as I just said before, the cumulative values are also there. The other important piece is that your item banking program should be able to store a large number of categories, virtually any categories that you choose as the faculty to track as part of your evaluation of the total curriculum, and therefore as relevant to each of the test items that you write. So a good example of that, you've got options with creating blueprints. Faculty can create a blueprint, but manually it's going to be obviously more simplistic simply because of the manual effort and time required to put it together. More simplistic than an electronically generated test blueprint. So my preference is always to use an electronically generated blueprint whenever possible. This will be a blueprint that's comprehensive in nature, that can show the overall distribution of items across not only your course objectives, but all of your important outcome measures and criteria that you've defined for your program. And when you have that item analysis available for every test that you've given, it's a very, very strong record. Documents your efforts to show that you've used consistency, fairness in the way you've weighted your tests and the way you've weighted your items that are contained on each test. An electronic blueprint should be created for every exam, and that blueprint can be lined up by categories of interest. So in this case for nursing, the overall exam should be reflective of test items that cover, for this curriculum, all elements of the nursing process, all elements of the client needs categories that originate from the licensure exam, and you should be able to see a percentage of those items that is appropriate to what your testing committee or the faculty as a whole have identified as being part of the overall plan for the curriculum. So for instance, if there's a real interest, particularly at the upper level of the program, to show that some of those tests that are now given in the final semester to the graduating seniors are indeed set up percentage and weight-wise very similar to the licensure exam, you'll have a way to identify your teacher-made test categories in that way, and I'll show you in a minute. You can line them up against the published licensure percentage categories on the licensure exam and make a direct match. Very important. It's going to show the students that they're being tested in the course right before they go toward the licensure exam at the point of completing the program, that they're taking an exam that's been constructed in a very similar way. Here's an example of an exhaustive category list, and ExamSoft has set these up as defaults. So the faculty don't have to go through the process in this particular application of even pulling those client need categories together. They're already entered into the program as a default set. So it's just a question of picking and choosing what scoring categories do you want to tie to each of the individual questions that you have in your item bank. Creates a very, very powerful blueprint. So here's an example of changes in NCLEX client needs, and these are, I would refer you to the National Council of State Boards of Nursing website, which is where this material is originally authored and presented. There will be a change following each of the job delineation surveys that occurs, obviously, as on these 3-year cycles. And as those percentages vary, you need to be aware of what those variations are, because when you're constructing your test blueprints in your program, you may indeed want to emulate those kinds of changes. So in the case of noting that there's been increases in the number of psychosocial integrity items on the licensure exam between 2011 and 2014 currently, versus there's been some decreases that have been noted in this case in safe, effective care environment. Do you want to make massive changes to your item bank? Indeed not. But do you want to really carefully look at how are you testing this content? One of the things I've noted is that faculty have become very proficient now at teaching psychosocial concepts in and amongst the physiologic integrity items. So they're interweaving psychosocial content within their test questions that are also addressing physiologic integrity. And that's a way that you can get more information out of that student when you're making a test question that requires them to pull information from both realms together in order to make an effective answer and choose the correct option. So there's a lot of ways that you can use your scoring categories to change the makeup of your test. And when you change the way your test is combining items and the way those items are weighted, you need to document that. And you'll have the blueprint as a mechanism for indicating why you made the changes, why the weights needed to be altered, and what your rationale was. So as always, I would just say in closing that item writing tools, the basics, I call them, that you've got to have. You clearly need to understand curriculum and that good golden triangle that we started with at the beginning of this discussion. You need a very effective test blueprint that demonstrates how this test has been put together, what you're actually testing, and why it's valid compared to those objectives that you've developed for the course. And ultimately, a tool for yourself that's very, very valuable is testing software that can make all of this so much easier to do. All the value of the statistics would be there at your fingertips without all the hassle of having to do any of that manual work. So I will say thank you for this opportunity to present the content, and I'll turn it back to Carter to see if we have a few minutes for some questions.
We do indeed have just a couple of minutes for some questions. There are quite a few, so I'm not going to be able to get to all of them, but I'll make sure that you get them, Ainslie. And for everybody whose question we don't get to, I'll be sure that somebody within my team is able to address your question as well. So the first question that I have is, beyond these references that you're listing out here, are there any resources for studying up on all of this information that's like more condensed, like a cheat sheet that somebody can keep beside their desk whenever they are, writing items to keep all this in mind?
Yeah, there definitely are. I mean, I would say, just again, because of my background in nursing, I usually go to the National Council of State Boards of Nursing as kind of a go-to site for some good, solid information about test construction, because it always helps to understand where that licensure exam is coming from and how it's being constructed. Obviously, faculty are not going to embrace the computer adaptive style testing necessarily, but there's some very good test item writing information contained on that site separate from the use of the adaptive testing program that's been adopted. So I would start there, and then again just conduct a kind of a classic literature search, as you have done probably in other aspects. One of the things I can say is that in all the years that I've done this, there's always something new that I learn from either another experienced item writer or from working with the information myself. So I applaud anybody who wants to take the time to do a little bit deeper dive into this area.
Very nice. Thank you. Next question that we have, and this seems like it might take a little while to explain. So if we only get to this one, then I apologize to everybody, but again, we will be sure that they're all addressed. Can there be negative discriminators because the higher scoring students are thinking too deeply about the concept or overthinking a little bit, whereas the lower scoring students would not think too deeply?
Well, that's a good way to characterize it. That could be it. A lot of what I've seen in cases where a higher scoring student is really well versed in the content, and then when you look at your answer, one of the things that can create this negative effect is that your answer may be reflecting the ideal, the quote-unquote ideal clinical situation, which is the way that the National Council discusses their methodology for writing an NCLEX style question. But the student may be referencing what they actually saw happen, let's call it, in real life in the clinical setting, where there may have been things like staffing shortages, lack of supplies, poor technique by one of the healthcare providers that then essentially colored their understanding of the application of that concept in the question. So then that's a situation I've been involved in where I had some of my higher scoring students, I couldn't understand why that question was negatively discriminating until we talked about it generally in a clinical conference discussion later, and I finally realized what was going on. So in some cases, I think what you have to do is you've got to give your students some test-taking caveats or tips, that things that will encourage them to act the same way on your test, perhaps, that they need to act on the licensure exam. So in those cases, you can't have those overriding factors influence your answer. You have to assume that the staffing is adequate, everything is essentially ideal about the setting, because you're making the decision based on the best practice that would be applied to that patient situation.
Very nice, thank you. And then let's just go ahead and do one more question. And let's see, I just had it, and where did it go? What are the standards of acceptance for PBCC?
PBCC really needs to be, particularly in nursing, at a level of 0.15 and above. So you really need to have a discrimination, a PBCC, for each question that's at least at 0.15. You know, 0.2, even better. But you've got to at least get to 0.15. And the thing that I would say about that is if your question is not at 0.15, just like in the discussion that I had with the slides, I had a question there that had a PBCC of 0.13. I could explain that almost immediately when I looked over at the difficulty level and it was 0.95. That question was too easy, so that means both my high performers and low performers, for the most part, were able to answer it correctly, and of course that's what suppressed my PBCC.
Very nice. And this is just about perfect timing. It's just a couple of seconds after 3 o'clock now, so I guess we'll go ahead and wrap this up. Thank you to all the attendees, and a big, big, big thank you to Dr. Nibert for this presentation today. Again, if there are other questions, I'll be sure that somebody on my team reaches out with answers. And again, you will all be receiving a PDF version of this slide deck as well as a link to the recording so you can watch it again within your email sometime within the next couple of days.
Great. Thank you very much. I enjoyed it.
We did too. Thank you so much. Signing off now.